Hello, my name is Nurse Pauline RN. Welcome to my channel. Hope everyone is doing good today. The title of my video is Fundamentals of Nursing, Exam 1, Part 2. Before I get started, please hit the like button, please hit the subscribe, and please share this video. Our first question today, what is community nursing? Primary focus of community health nurse in the clinic is to decrease incidence of diseases in the community, increase the ability of the patient to self-manage their symptoms, provide education programs to families and patients, community nurses also provide information to teachers in the local schools, teaching health promotion, illness prevention. Community nurses improves the health of the community, children, and provide resources for children. Vulnerable population of patients have more health problems. They have excess risk, limits in access to healthcare services, and dependence on care from others. Public health problems affecting the elderly patients in the community are substance abuse, confusional states, financial limitation, acute and chronic physical illness. When a patient has an IV in, maybe the nurse placed the IV in the patient's arm on admission, that IV stays in the patient's arm. The answer is for 72 hours. Within that time, if the IV becomes infiltrated, the patient say, I need another IV. This is stinging, hurting. I need another IV. You have to take that IV out immediately and reinsert the IV before 72 hours. So that's a PRN, and IVs are in for 72 hours or less. Signs and symptoms of IV infiltration is tenderness, warmth, burning, swelling, redness at the injection site. When you have insulin vials, you are diluting. When you have medication in a vial, you are diluting powders. Please rotate the vial gently between your palms. When you're administering insulin to your patient, if your doctor orders regular insulin and NPH insulin to be drawn up in one syringe, you will remember RN. RN. R stands for regular insulin, clear insulin. N stands for NPH insulin, cloudy insulin. You draw them up, RN. R is first, N is last. Then you administer your insulin to your patient. For patients Assessment of vomitus. You'll assess for the presence of blood. If there is any blood in the patient's vomitus, notify the doctors, especially your post-op patient. Your first post-op patient is an unstable patient. You will notify the doctor stat. Remember your therapeutic communications with your patients. Close communications are blocks. Open-ended communication allows the patient to elaborate. Do not ask the patient why. Never ask your patient why. Never ask your patients questions that you expect the answer to be yes or no. We need open-ended communication. We need patients to elaborate and explain more to us. When you're taking care of your patients, your focus should be on your patients' feelings, concerns, anxieties, and fears. Eye ointments are administered from the inner to the outer canthus. If the doctor gives you an order to administer liquid eye drops and eye ointments, you will apply the liquid eye drop first. Then you come back 5 to 10 minutes and administer your ointment eye drops. Eye drops are administered from the inner canthus, the lower level, to the outer canthus. When you have injection needles, what do? You do not recap used injection needles. Do not recap, risk for finger sticks. When you're lifting objects, bend your knees, back straight. Keep object close to you. Prevents back injuries of nurses. When patients are choking, what do? The Heimlich maneuver, abdominal thrust. If you are rescuing a drowning patient, what do you do before you administer your AEDs? You will remove all water from the patient's body. No water before you press the charge button on your AED machines. You'll accept safety of your patients while you're taking care of your patients. You'll make sure your bed alarms are on, your call lights are on, the phones are close to the bedside. We don't want our patients hanging over or reaching over for things. Their personal belongings, their bags should all be close to them. Side rails should be up ×3. Side rails ×4 is a restraint. If you have to elevate 4 rails of your bed, you have to call the doctor for a restraint order. First priority, you have received a patient admitted for chest trauma. What do? You assess the airway patency. Patient on heparin is on bleeding precautions. What is the sequence of assessing the abdomen? In 4 quadrants of the abdomen, you will inspect first. Second, you will auscultate. Third, you will percussion of the abdomen, then palpate last. What do you do if your patient is having shortness of breath, difficulty breathing? What position would you place them in? You would place them in the orthopneic position. Patients are on IM. Patient on Latex. What do you assess? You will continue to monitor your patient's potassium level because they're on water pills. They're going to the bathroom regularly. They're losing their potassium. If your patient is complaining of pain, swelling, redness, tenderness in the leg calf, what do? You notify the doctor ASAP. This is warm to touch, tender. Signs and symptoms of deep vein thrombosis, thrombophlebitis. Notify your doctor ASAP. Patients have the right to refuse treatments. We do not refuse them to take their medications or injections. We will notify the doctor, but the patient has the right to refuse as stated in the Bill of Rights. Sputum specimens. When is the right time to collect your sputum specimens? We collect sputum specimens first thing in the morning. First sputum in the morning. When you're administering your IM injection, how much milliliters of injection, the most that can be administered in the deltoid? The most you can administer for IM injection in your deltoid, mid-deltoid, is 1 milliliter, not more. The patient will start complaining of pain, burning. We don't want to go through that. Insulin injections. What is the size of your insulin injection? Your insulin injection is a subcutaneous injection. I'm sorry, what is the size? Forget about your insulin injection as specific needles for insulin injection. I'm sorry. What is the size of your heparin injection? That's your subcutaneous injections. Your sub-Q injections for insulin is 25 gauge, 5/8 inches. 25 and 5/8 for your subcutaneous insulin injection or any other sub-Q injection. Developmental level of communication for children. How do you communicate with your children? You should explain things to the minors in simple words. Patients have a bed bath. Who administers the orders for creams and ointments prescription? Do you give them to your techs to administer? No. Ointments and creams are prescription ordered by the doctor. Only the registered nurse gives prescription medications in the hospital, not the tech. Psychosocial development occurs in various stages of human life that are environmental. Psychosocial development occurs in stages that was developed by Erik Erikson stages of development. Physiological development in size, function of a person is associated with genetic influences and nutrition. Cognitive development. What is that? Cognitive development is how we learn. Elderlies are at risk for osteoporosis. Elderlies are at risk for falls. If a patient is confused, it will be helpful to ask the doctor to order a urinalysis for these patients, because in the elderly, they are at risk for urinary tract infection. That's the first sign, confusion. Do not cut fingernails and toenails of diabetic patients. They are at risk for amputations. What do you know about changing the gown of a stroke patient? If a patient has stroke in the left arm, you put the gown on the affected left arm first. The right arm, the good arm, is last. For a male patient, if they have stroke on the right leg, you place the pants on the affected side, the right side first. The gowns, the pants, they always go on the affected side first. The unaffected or good side is always last. Is pain subjective or objective? Pain is what the patient says it is. Pain is not what the family tells you it is. Assess your facial grimaces. Pain is subjective. It's what the patient says it is. In Erik Erikson's stages of development, 0 to 18 years, that is trust versus mistrust. Adults 65 and older is integrity versus despair. What does DNR means? Do not resuscitate. What are universal precautions? There are interventions using gloves, goggles, and face shield. RN does not delegate educations to LPNs. RN does educations. RN does parental nutrition. RNs are the only ones who can insert central lines IV, not the LPN. Before a registered nurse delegates an assignment, what should she determine? She should determine the level of education the nurse has, the knowledge of the skill, competencies Also, level of critical thinking. If you have a new nurse on the floor just graduated from college, do not give that nurse a fresh post-op patient, because it's a new nurse, first day of this on the floor. Delegate your assignments, determining the level of education, knowledge, skill, competencies, and critical thinking. Are PCT allowed to ambulate your patients? Yes, if they are stable. If they are unstable, fresh post-op patients, RN is the only one who can ambulate and get that patient out of bed. The PCT can be a standby assist. Can PCT administer Tylenols and aspirins? They do that at home. We all do. But in a hospital, only nurses are the ones who gives your patients Tylenol and aspirin. Do not give it to the techs. In a change of shift report, what do we do? In a change of shift report, one RN coming, the other RN is leaving. The RN reports clues as to the priority of each action she implemented on her patient. What does invasive procedures mean? Invasive procedures means the body is usually entered by cutting in or puncturing the skin by inserting instruments into the body. What do you do if your patient is admitted with a history of smoking? Your patient may say he smoked 2 years ago, but if you really think in your mind that this may not be true, give all your patients who have a history, or they could say they're smoking last night, give them a cessation packet or pamphlets to them and their families. They need smoking cessation education. That's what you do. If your patient is unable to swallow medications, what do you do? Communicate with the family to replace maybe that oral pill with a liquid pill. Some pills comes in form of liquid and oral. If the patient is not able to swallow, you can have the doctor order a speech therapist to come to the bedside to do a swallowing evaluation on your patients. In the meantime, you're waiting, place that patient on NPO. Nothing by mouth until swallowing is evaluated. Do RNs witness wills? No, they don't. If the lawyer or family calls you to the bedside to be a witness for your wills, we are not witnesses. We do not do that. If a doctor has an informed consent and call you to the bedside to be a witness, are you allowed to be a witness to an informed consent for surgery? Yes. The doctor signs the informed consent, and the RN is the second witness in the presence of the patient, the doctor signs this informed consent as a witness, but the doctor is the one who is responsible to sign the informed consent and explain to the patients any alternatives they could take to replace surgeries and explain the surgical procedure to the patient. So nurses, we do not sign. We are a witness at the bedside along with our patients. Who is an emancipated minor? An emancipated minor means legally child before attaining age of majority is free from control by parents or guardian. Parent and guardian are free from responsibility toward the child. What is Guaiac stool? Guaiac stool, we are testing for blood in stool. We put our stool in a container and we send it off to the lab to see if the patient is experiencing any internal GI bleed. Is positive, notify the doctor ASAP. What do you do when your patients fall? So long as their body touches the ground, it's a fall, not a slip. You may disregard it. Then one day the family come out and say to you, Pauline, my mom told me she fell last night. Do not disregard it. If the patient's finger touches the ground, it is a fall. You can hear it again, maybe from the family or friends who the patient tells this. If a patient falls, what do? You notify the doctor ASAP to come to the bedside and examine your patients. Sometimes patients have fractures. They have to go for x-ray. When your patients fall, what is the nurse's responsibility? Nurse's responsibility is to give your patient a complete head-to-toe assessment and call the doctor. Document. Patient has a history of seizure or have experienced seizure in the hospital. What do? You will pad all side rails. Make sure you put a seizure precaution sign over the bed at the door. We have to have seizure precaution for seizure patients. Do not place anything in the patient's mouth if they are having a seizure. During a seizure, that's a test question. You do not place anything in the mouth. Test question, keep your patient safe. If it's on the ground, the patient is having a seizure, move all the furniture away from the patients. Keep the patient safe until when this seizure has stopped. Notify your doctor. Make sure you time is the doctor is going to ask you, was it 5 minutes seizure, 10 minutes? Timing is important. Please assess. For patients with a Foley catheter, what kind of asepsis do you maintain for patients inserting a Foley catheter? A patient receiving a Foley catheter will use surgical asepsis. It's a sterile techniques, sterile gloves, sterile procedure. Long-acting insulins. What are your long-acting insulins? Your long-acting insulins are Lantus and Levemir. Those are two examples. What is pulse pressure? Pulse pressure means the difference between systolic and diastolic blood pressure. If your systolic is 120/80 diastolic, the answer is your pulse pressure is 40. 80 minus 120. Your hand washing. How many seconds or minutes do you wash your hands for? The answer is 20 seconds. Patients diagnosed with C. diff. The specimen was sent to the lab and the diagnosis in your lab reports was C. diff. What kind of isolation would you put your patient on? Patient would be on contact isolation, gloves, gowns, and C. diff means Clostridium difficile. That's what that means. Test question: how do you wash your hands for C. diff patients? Is it 20 seconds? No. In a test question, washing hands for C. diff patients, you will wash your hands. That's what you'll pick up with running water after you remove your gloves. After you remove your gloves, running water. C. diff is diagnosed. Wash your hands, running water. After you dry your hand, then you can use antiseptic wipes or sanitizer, whatever you need. But the answer is running water, always after you remove your gloves. Contact isolation, gowns, gloves. You can use, sometimes you're bathing them to prevent splashes. You can put on your goggles. Where is the SI sound located? The SI sound location is the fifth left intercostal space along the mid-clavicular line. The SI sound is loudest at the apex of the heart. How many cc's of urine are you expecting your patients to urinate, especially if you're checking your Foley catheters? It's 8 hours and there's no urine. How much cc's of urine are we expecting each hour? We are expecting 30 cc's of urine every hour. Average adult urine excreted daily is 1,500 to 2,000 mLs daily, 30 cc's an hour. If your patient, especially your fresh post-op patients, if they are not doing 30 mLs an hour, communicate with the doctor as soon as possible. Your fresh post-op patient may be retaining urine, and these patients are at risk for hemorrhages. Do you know what your objective daters are? Your objective daters are your vital signs, example, your laboratory data, your EKG diagnostics. You have a sublingual medication. What does sublingual, where do you place your sublingual medications? Example, nitroglycerin is placed sublingually under the tongue. You'll ask your patient to lift their tongue to the roof of the mouth and place the medication under the tongue, on the floor of the mouth. For unconscious patients, which pulse do you palpate? For unconscious patients, we will palpate the carotid pulse. If your patient's urine is yellow, what do you do? If your patient's urine is yellow, look in your med profile, see if your patient is receiving a medication called Peridium. If your patient is getting Peridium, expected urine is orange. This is harmless symptom. If your patient's urine is red, what do? You notify your doctor. Blood should be clear, odorless, light yellow. If your patient is suspected of neck injury, in CPR, how do you administer CPR to a patient of suspected neck injury? We will do the jaw thrust method to open the airway. Are you allowed to take pictures of your patients while you're in the hospital? No, you do not take pictures of your patients without their consent. Please do not. The families may not like that. Your axillary temp is 1 degree lower than your oral temp. A tympanic thermometer is used to measure the core temperature, that are the internal structures of your body, deep structures of your body, core temperature. Patient has a history of latex allergy. This patient is at risk to develop what? Patients with latex allergy, if you're not using latex-free supplies, are at risk for anaphylactic reactions. Example, shortness of breath, difficulty breathing. You notify the med team stat. This is an emergency. Notify your doctor stat. Use latex allergy-free gloves, latex-free Foley catheters. We have supply cards that are latex allergy supplies, latex allergy-free supply cards that you can roll in by the patient's bedside for them to use. Make sure they are using their latex allergy bracelets. What kind of gloves do you use to insert a Foley catheter? We will use a sterile glove, not a clean glove. Patients are at risk for urinary tract infection. All restraint orders should be documented every 2 hours. Restraint orders are ordered by the bedside, and it lasts for 24 hours. After 24 hours, it is not valid. You have to get another restraint order, a new order by your doctor after 24 hours. Restraints are not used unless other alternative methods have been attempted. You bathe them, you wash them, you try to make them clean, you freshen them up, you medicate them. Nothing is working, and they're still jumping out of bed. Restraints are used unless all other alternative methods have failed. When a patient has a restraint, what do you assess? We will assess their fingers, colors, sensations, circulations. Are the fingers blue? We are assessing for movements in their fingers, or if it's soft lip wrist restraints in their upper arms and lower arms, their toes, their fingers. Patients with restraint, we'll get them up and ambulate them to go to the bathroom, let them shuffle around a little. We'll give them fluids. We don't want them to go into dehydration, especially the elderly. We'll make sure they're getting their nutrition. You're feeding them with breakfast, lunch, and dinner. Patients, it is the patient's obligation to report elderly and child abuse on admission. Signs of cigarette burns, signs of bruises, wales, cuts, unexplained injuries, elderly children. What is community incident rate assessment? Nurses are collecting data to determine how many, for example, adolescents have attempted suicide in the community. The community clinic is initiating a lead screening program. This activity in the community is based on social determinants of health, which is physical environment. So nurses in the community, they are responsible for collecting data in the community. They are responsible for lead screening programs in the community. Examples of counselor in the community. Example, nurses, community nurses are counselors. They do smoking cessation programs in the community. They are focused on health behaviors in the community. A community health clinic notices an increased incidence of chickenpox in the community. What does she do? The community nurse will notify school nurses in the community to assess students in the community. The community nurse will notify the school district employees. The community nurse's role is acting as a collaborator and an epidemiologist in the community. A community nurse is in the community, and she is determining the health need of an immigrant population. She will identify what immigrant population views are on and the most important needs they have. She will determine how the immigrant population uses healthcare resources. She will identify barriers perceived for healthcare in migrant population. She will do safety assessments on elderly. She'll do teaching for elderly. Elderlies are in need of more proper lighting, locks, clutter-free environment. She'll assess their medication, lighting in their homes, prevent falls. And we will stop there for the day. Thank you. Have a blessed day. Hit the like button, subscribe, and please share this video. Thank you. I think I'm going to be doing part 3 on Fundamentals of Nursing Exam 1. So Fundamentals Nursing Exam 1 as part 1, part 2, and I'm going to give you a part 3 because it's a lot of information, and the more information you get, if you can pass your exam 1 and exam 2, you know you will pass fundamentals, okay? But you have to get over exam 1 and exam 2. Thank you. Have a good day.